Hi, this week's health tip, we're going to be talking a bit about the different aspects of your brain and what they do. So I do a lot of special neurology work with kids that are in the autism spectrum with ADHD and that sort of thing. And our sort of theoretical look at it is we're looking at something called the hemispheristic model of their problem. So when from conception to about 3 years of life, the right side of the brain is the one that's having more development. It's developing quicker and kind of laying the groundwork for the basal functions of living in a society. So we say that your right brain will give you what we call your EQ, right? So that would be your emotional quotient instead of your intelligence quotient, which would be more your left brain. So if there's a challenge to the baby from either like a stressful pregnancy, drugs, lack of oxygen, whatever it is within that first 3 years, it may have a bad impact on this expression in the child. So that the right side of the brain would be, if it had decreased effects or wasn't working as properly, or it had improper connections, it wouldn't be expressing itself properly, so that would show in the child's, for example, in not having eye contact, lack of social interaction, social skills, not having the right filters for behavior in public, acting out, spontaneous movement sometimes. Right side of the brain also has a very big impact on the large global postural muscles. So if this right side of the brain is kind of weak on the child, it might be the floppy kind of child. So some of the things parents should be looking for if they have a newborn baby that's in the first months of life. Some of the things you should be kind of making sure that your child has is fairly good tone. Can the baby support itself? If you're just starting to lift it up, is it starting to activate its neck muscles? A lazy baby that doesn't want to breastfeed, that's a pretty good indicator that there could be some challenges with the motor system and the general control. So these are things you want to be looking out for and making sure that you're getting your child obviously checked by your family doctor, neurologist, but also being checked for the nervous system by the chiropractor. That can have an impact on how the brain is developing. So these are just some general things. We're not trying to diagnose any diseases or anything like that, but just some tips on how the right brain can have an effect on the body and some things to look for. And in the next couple of weeks, I might give you some specific little exercises you could do if you think that your child might have a right brain weakness. There's some things that you might be able to do at home, some eye exercises and different things that we can help stimulate the right side of the brain. And I'll get into that in future sessions. So that's sort of like a really general overview of things today.